Hello, this is Dr. Todd Peterson again. I want to thank you so much for making it this far into these different videos that have been sent. And I want to encourage you to schedule and keep your neuropathy evaluation appointment with me. Now, when we look at neuropathy, there are well over 100 different ways someone can acquire neuropathy or have neuropathy manifest in their body. Some of the more common causes are from diabetes or chemotherapy induced, or different toxins that get in the body. Some of those can be from chemical exposure in plants or factories. Even Agent Orange for those that served in Vietnam. And thank you for your service. What we also see is there's some alcoholic induced neuropathy and also injuries, whether those are spinal cord injuries, stenosis of the spine, and sometimes even post-operative spinal surgery can lead to neuropathy. Now, another one that's super common is something called idiopathic neuropathy, which means basically we don't know how you got it, but we know that you do have it. Now, in all forms of neuropathy, they are the same. What's happened is that this nerve cell, and let's picture that as my hand here, is this part right here, and then these fingers, picture them as the vessels that come in and feed that nerve body or that nerve cell. And what happens with neuropathy, no matter what the cause is it affects those vessels to where they start to where they don't function properly. And when that happens, they start to shrivel up or degenerate. And when that happens, the blood vessels that come in that give the nutrients for the life of this cell, they start to diminish. And so the whole nerve body starts to diminish and deteriorate. And this takes time. This doesn't happen immediately. So what's going to happen is that once it does start to affect you, you're going to start feeling it. And you're going to start maybe feeling numbness, tingling, maybe even burning, pins and needles. Sometimes there's even something like a club-like sensation that you feel, or maybe it feels like you're walking on pillows. And then there's the pain and the burning and throbbing and cold hands or feet. And sometimes you'll even start to develop balance problems, because the nerves that go and affect your feet, these are the same nerve cells that we're talking about. So you're not able to have proper proprioception or finding your balance in space. And when that happens, you can feel like you have a shuffle in your walk, or can also lead to falls, which is also dangerous. Or like if it happens in your hands, you can go to grab something and not be able to feel it, and you're going to drop it. Now, when these all start to occur, these types of symptoms that we talked about, they really start to affect individuals' lifestyles and how they're living their life in a very dramatic way. Also, sleep can be affected, and this pain with all these symptoms are typically, they're going to be typically addressed via medication. Now, that is really just a Band-Aid for what's going on here. That's not doing anything to help fix these vessels. That's just masking the problem, not making it go away. Now, that's not treating the root cause. And so here in our office, what we've found is that we found a way to come in and help treat this root cause, where we come in and help restore flow back to these vessels that feed this nerve, and that the vessels bring in the nutrients and the things that are needed to keep this nerve healthy. So over time, what's going to happen is that these vessels are going to start to heal, just like other things in our bodies. So like if we ever get like a cut or anything like that, the skin's going to heal. Or, anything like muscles, if they tear, which is going to happen with people who work out or play sports or just living life, muscles can heal on their own, but given the proper environment. And we know that nerves can heal given the proper environment. Now, neuropathy needs a little extra help, and that one of our primary focuses here in our office is helping patients create the proper environment for these vessels to heal. Now, depending on the type of neuropathy, as well as the level of damage of this nerve cell, will determine where you are. And we're hoping that what we've done is we're catching it before it becomes what's called a permanent nerve damage, which we don't want. We're hoping that we're going to catch you before then. And we're going to catch you in one of those stages. Now, the only way for me to determine where you are in the different stages of this nerve damage is for you to come in and see me. And I want you to come in, and I encourage you to come in for an evaluation. Encourage you to schedule your appointment. Keep that appointment. Meet me, my staff, and let's see if you can be the next successful patient within our treatment program. We want you to have the most active lifestyle. Play with your kids again, your grandkids, go on walks, go fishing. Do those things that you love that help you feel you and the person that you're meant to be. I really do look forward to meeting you, and I want to see if this is a program that can help you. And the only way for me to do that is for you to come in and see me. So keep that appointment, schedule it, and I look forward to seeing you very soon. Thank you so much for your time.